And welcome to Wellness Live. My name is Dr. Olivia Moses, and this broadcast is brought to you by Loma Linda University Health's Department of Risk Management's Living Whole Wellness Program. We are so excited that you have joined us here today. Now, if you are watching us live, you have an extra special treat because you can actually ask questions live to our wonderful guest speaker. But before I introduce her, I want to actually talk to you a little bit about February. Now, if you are watching us live, you know that this month is February and it's National Heart Health Month. So, of course, we had to talk about the heart. And we have a wonderful guest here with us. Her name is Dr. Purvi Parwani. She's an assistant professor of medicine here at Loma Linda University, and she's the director of the Women's Heart Clinic here. Now, she is one of our amazing cardiologists that we have here at Loma Linda University Health, and I cannot say enough good things about her. She is one of those physicians who is passionate about what she does, and she believes and focuses on lifestyle and prevention when it comes to heart disease and heart health. So I am so very thrilled to introduce you to Dr. Parwani today. Now, as we go along with this presentation, please remember that Wellness Live is every month, and we would love to have you join us. So without further ado, I'd like to introduce you to Dr. Purvi Parwani.
Thank you, Dr. Moses, for that kind introduction. So I will start sharing my slides. I'm honored to be invited as part of this wellness initiative, speaking about heart health. So what I'll be doing today is I will first speak about the incidence of cardiovascular disease, and then I will dive deep into how the diet relates to that. So as you heard, my name is Dr. Purvi Parwani, and I'm a cardiologist at Loma Linda University, and I am also the director of Women's Heart Clinic, and I combine various advanced imaging techniques to focus on prevention and also to treat cardiovascular health in women, but also in all the cardiac patients. So my disclosure is that I practice what I preach. So I told Dr. Moses that I'm wearing green so that no one has any doubt what I'm going to preach about and what I'll be speaking to you all about today. Although it's Heart Month, and I actually purposefully chose a green outfit for this talk. So heart disease is the leading cause of death for men, women, and people of most racial and ethnic groups in United States. One person dies every 36 seconds in United States from cardiovascular disease. And that means by the time we started speaking, there are probably 8 deaths that has happened due to cardiovascular disease. And that leads to 1 in 4 deaths of Americans due to heart disease every year. And believe it or not, this is a $1 billion expense on our healthcare system. So this analysis was done back in 2015, which showed that almost $219 billion each year are used on cost of healthcare services, medicine, and lost productivity due to death. And I'm sure this number is growing as we speak because now we are in 2021. Unfortunately, the medicine today, I feel like a lot of efforts that a healthcare community focuses on, it's on mopping the floor without turning off the faucet. So we have lots of advances in diagnosis and treatment of cardiovascular disease. But the big picture is that we need to prevent cardiovascular disease from happening. And I think we really need this focus on diet, since in my opinion, that's one of the prime causes of cardiovascular disease in the United States as time have changed. So speaking about the diet, let's speak about the standard American diet. So unfortunately, standard American diet is sad. 3 out of 4 Americans don't eat a single piece of fruit in a day. If you can look at this infographic on the left side, 9 out of 10 don't even reach the minimum recommended intake of vegetables. 96% don't reach the minimum for greens in a week. So mostly Americans use 610 calories a day from the grain products, which is, unfortunately, the refined grains, and only 206 calories from the fresh fruits and vegetables. So 32% of the overall calories comes from animal foods. Unfortunately, more than half comes from processed plant foods, and only 11% from the whole grains, beans, fruits, vegetables, and nuts, for which I'm going to provide you with more data today. So unfortunately, when we look at these blocks of nutrition, look at what happens when we do overconsumption on the added sugar, saturated fat, and sodium. If you, we have found every reason to find these sugary drinks, right? And we are focused on the saturated fats in many ways in junk food that we consume. And then unfortunately, sodium, all of this leads to diabetes, obesity, cardiovascular disease, and high blood cholesterol, as well as hypertension. So hence, I'd like to propose, this has been talked about in many prevention talks, but it's actually not coronary artery disease. I would argue it's actually the culinary artery disease, because diet plays such a big role, on the development of cardiovascular disease in our vessels and on our cardiovascular system overall. So there are many causes of cardiovascular disease, but here, I'm just showing you the root causes that are all very strongly tied up with the dietary intake and how we consume, diet.
Well, thank you, Dr. Parwani. We are going to get to some questions right now. So if you have any questions, go ahead and type them into the comments section while we have our expert here today. It's a really great time to start to tap into her expertise. Well, you brought up a lot of information, Dr. Parwani, so far about nutrition, and now you're speaking my language when it comes to nutrition. Why do you think it is that we have such a disconnect between nutrition and what we're putting in our bodies and how we're feeling and our heart health? Because I think all of us know we probably shouldn't be going through a fast food, lane every day and, eat sugary snacks and drinks and, all of that. We all know that that's not healthy for us, but how can we still do it? What are your thoughts?
No, that's a great question, right? So, talking to our patients every single day in the clinic about heart health and diet and its relationship, one thing is for sure, very much confirmed, which is food is emotional for people, and behavior is the most difficult thing you can change in anyone, right? So somehow, when we look at these, the fast food and the junk food, somehow our taste buds are so tied with this food that we consume. And it's kind of difficult to dissociate from them. And, it really needs a strong willpower. And I'd say that, rather than putting blame on our patients, I think this doctor-patient relationship should be so strengthened that, the patients understand that we are their, the biggest advocates, and we are here to help them in this journey. The other thing, Dr. Moses, which is so sad in United States, is that you can find a burger for half a cent or, half a dollar for 50 cents. Mm-hmm. And if you go to buy a salad, it will cost you, $8 to $10, right? So I think, until these public health efforts are focused on making food accessible, particularly for our lower socioeconomical class, we are going to be seeing, like, if, it all comes down to that, in my opinion. And, serving San Bernardino County as we do at Loma Linda, we see these issues come up in our daily practices on routine basis.
No, absolutely. I can't agree with you more. And I also think that, this connection between how our emotions and what we eat is so strong. And I don't think we talk about it enough and acknowledge that that's definitely something that needs to be addressed. I also think, too, that when we get used to eating that way, it is very, very hard to stop. And we have to acknowledge that, too. And in addition, It's instant gratification, right? It tastes good now. We're not thinking about heart disease 10 years down the line.
Yes.
So there's so many factors, but we have some good questions coming in. We have, can stress cause heart disease?
Of course, yes. Stress causes heart disease. So I'll take that opportunity and kind of explain what the process of atherosclerosis is. So when we refer today heart disease, we are speaking about cardiovascular disease that is exhibited in form of coronary artery disease, which is basically because of atherosclerosis that goes on into our vessels. So atherosclerosis, it's a lot of people say that, oh, as I get old, I'm going to get heart attack and stroke. And that's not true. And being from the blue zone, we know that that's not true. But atherosclerosis is basically disease of inflammation. So big, medium and big vessels in the heart and everywhere else in our body, have this inflammatory cascade that goes on that gets initiated from the cholesterol that gets oxidized and then gets deposited in the vessel wall, and that process is called atherosclerosis. Now the problem in the body happens when these plaque build up, they break, and that process, if that happens in the heart, that leads to heart attack. Now what does stress do? Stress leads to that, it kind of triggers that process of inflammation as well as triggers the breakage of that plaque. So of course, stress is very tightly related to how people get heart attack, and those Hollywood scenes that you have seen that people get stressful situation and put their hand on the heart. Those are very true because stress definitely can lead to heart disease.
Now, you talked about atherosclerosis, and I want to kind of tap into that a little bit because if stress causes it, nutrition causes it, we have that throughout our life. So we eat and we have stress, no matter if you are 75 to 15, you have all of those things. So when does atherosclerosis begin?
Yeah, no, that's an excellent question. So atherosclerosis begins the minute we take birth and come into this world, and there is some evidence from autopsy studies that were done in children, and they saw these petty streaks in the vessels of the kids. When they did those autopsies, and that was tightly related to the high LDL, the low HDL, the insulin resistant, obesity, etc. And then the other set of evidence comes from, like Vietnam War or Korean War, American soldiers. So they did autopsy studies on these soldiers. And what they found was even in the young soldiers from average age, I want to say like between 25 to 45, almost 50 to 70% of them had some sort of atherosclerosis. So, the process starts early on, and it keeps happening as our age advances. And the main thing that I want to kind of point is that the process happens, but it's all about how do we stabilize that process and how do we not make it worse, right? Because we are in the blue zone, the only blue zone in United States, and we know in Loma Linda people live very long. And why does that happen if the atherosclerosis is happening early in the age? Because there is this good diet that we'll speak about more. There is this sense of community, the sense of purpose, some religious affiliation, exercise, hikes, etc. So I think that the process happens, but the main question we should be asking ourselves is, how do I hold that process of atherosclerosis that's naturally going to happen in our body?
Okay. The exciting thing about what you just said is there is something we can do about it. We just don't
Yes.
have to wait for this bomb to kind of explode. Well, let's get to one question. Maybe you'll be answering this later on. But we had a question come in that says, what foods affect my heart? And you talked about fast foods and that type of thing already. So are there specific foods? Maybe we'll ask the opposite question. What is protective potentially for the heart?
Yes, and that's all my talk is about. The rest of my talk is about. So why don't we dive deep into the presentation now, and then we'll come back to that question if you don't mind.
Perfect.
Yeah. Okay. So as I said, coronary artery disease, in my opinion, is culinary artery disease. And that's because the food is very tightly related to the coronary artery disease. But the question next happens, what do we know about food? I am having difficult. Oh, here we go. Okay, so what do we know about the food and what evidence exists out there about relationship of food with atherosclerosis? So this is from American College of Cardiology, American Heart Association prevention guidelines that were released in 2019. And this is answering our last question. This is what the guidelines say. All adults should consume a healthy diet that emphasizes on intake of vegetables, fruits, nuts, whole grains, lean vegetables, or animal proteins, fish, and minimize the intake of trans fats, red meat, processed red meats, refined carbohydrate, sweetened beverages. So now on the right side, if you look at this, this is the level of evidence. So class 1 is really good in anything cardiology, right? So this basically shows that there is clear evidence, without doubt, any doctor can recommend that the diet that emphasizes the intake of vegetables, fruits, legumes, nuts, whole grains, and fish is recommended to decrease the atherosclerotic cardiovascular risk factors in our patient group. And as it becomes yellow, it just tells you that, that evidence is a little less pronounced because of the quality of the studies that are done. And as it becomes red, that's absolutely harmful. So no one should be consuming trans fats because it definitely increases the risk of, heart attack and stroke. And we'll deep dive into this. There's a lot of evidence, but I have predominantly taken the evidence that is presented in the guidelines because we know that it is very well peer reviewed. So that class 1 evidence that you saw on the previous slide, that comes from this trial that everyone talks about in cardiology. And I think a lot of our patients are also excited to talk about this. So this was what we call Predimed Trial. And this basically happened in Spain. And they examined around 7,500 patients or with Mediterranean diet supplemented with extra virgin olive oil or nuts. So the diet components are right here. So it comprised of olive oil, peanuts, fresh fruits, vegetables, fatty fish, legumes, sofrita, white meat, and wine with meals. This trial showed that if you consume Mediterranean diet that was supplemented with extra virgin olive oil, there was decrease in all-cause mortality as well as cardiovascular mortality by 30% compared to the control group trial, which you can see here, which is actually not bad. It's actually way better than standard American diet. So the control diet had low-fat dairy products, bread, potatoes, pasta, fresh fruits, vegetables, and lean fish and seafood. But even in this they discourage red meat and processed fatty meals, which is what standard American diet is. So you can imagine if the standard American diet was the control, how much of the benefit you would derive in this trial. But the endpoint, were together with heart attack. It was also stroke and any cardiovascular mortality. We know that these endpoints were largely driven by reduction in the stroke. I'll show you the next trial, which no one, probably it never came into this limelight. But what they did was they took this group of Predimed Trial group and they gave positive score to the people who consume vegetables and fruits and legumes and gave negative points to the people who consumed eggs, dairies, animal fats, etc. And this pro-vegetarian food pattern was associated with almost 41% of decreased mortality. So saying that if you, make that Mediterranean diet, further divided by vegetarian pattern that was free of processed food, it actually had further increase, with mortality rate reduction, which is amazing. And this is what we have shown at our Loma Linda cohort, right? With Adventist Heart Study, my colleague, Dr. Fraser, was the chief author on this trial. But basically, the SDA, within the SDA population, there are 5 dietary patterns that were identified because there was no enforcement of what the population, the church population should follow. But so hence they came up with these five categories that people were following, and you can see that within these five categories, vegan population had they were the lightest. I haven't put the other slides, but they also had the least evidence of high blood pressure, diabetes, as well as cardiovascular disease. So predominantly the vegetarian as well as vegan. So the plant-based diet was associated with lower all-cause mortality, and even with our own cohort, there was some reduction in the cause-specific mortality, including cardiovascular disease. So same from the Adventist Heart Study, again, when they examined meat protein versus the plant-based protein, they saw that meat protein was associated with 61% increase in mortality rate. So you can see all these, within any age group from 25 to 85, the meat protein was associated with higher mortality. And on this slide, which is plant protein, you can see lower mortality below this, this line of 1. So it was associated with lower mortality rate overall. This paper is from some of my friends in Europe, and what they did was they basically kind of combined all this data that exists, and they came up with kind of analysis of doing everything together. And what they found was beneficial was root vegetables, green leafy vegetables, cooked vegetables, cruciferous vegetables, whole grains, fibers, nuts. And I will show you what was harmful in this analysis. Again, the same pattern: processed meat and canned food was not good. So then going forward, so we all have heard about effect of fat on our, overall cardiovascular health. Now I want to break up fat for our, listeners. So fat can be trans fats, which is the worst kind of fat anyone can consume. So this is the hydrogenated vegetable oils, the fast foods, cake, pastries, chocolates, deep fried fruit, etc. Then you have saturated fat, which is found in animal fats, but also in coconut oil, coconut milk, etc. And then you have the good polyunsaturated and monounsaturated fat. So this is where our olive oil, other oils fall. And then polyunsaturated fat also includes the fatty fish that we saw in Mediterranean diet. So what we know is that trans fats are not good. Trans fats can lead to everything in cardiovascular system that you don't want it to happen, right? So it can lead to metabolic dysfunction, increase the lipid level, it triggers systemic inflammation. It's been associated with cancer. It leads to endothelial dysfunction. It can lead to, more body weight, insulin resistance, diabetes, everything bad that can happen with trans fats. So this is the fats that we need to absolutely avoid. This is the fat we need to keep at less than 10% of our overall intake. And this is the fat we should be consuming, on daily basis. So now, if we look at all the, like the saturated fat and the mono and polyunsaturated fat, this is a very good graph. So when they tried to replace the trans fat with the poly and monounsaturated fat, you can see how the mortality decreased in this paper. You can see how the curves went down. And this is very powerful data, right? So the plant protein was associated with the reduction in mortality of 10% for every 3% energy increment that happened with the replacement of animal protein. And this is a graph just to show you why we care about saturated fat is because blood cholesterol has been associated with saturated fat. So trans fats and saturated fat leads to high cholesterol, leads to high LDL, and LDL has been associated with atherosclerosis, which can lead to heart attack and strokes. And that's why we are having this conversation. Now, the Southern pattern, this was a big cohort that examined the Southern American food pattern, and how it was associated with mortality. So you can see this graph going all the way down, and this is the Southern pattern. So compared to plant-based diet, which is depicted here in green, the southern food pattern was associated with the worst mortality. So it led to 56% higher risk of heart disease and 30% higher risk of stroke. And we all know how that food looks like: more fried food, more fats, organ and processed meat, and sugar sweetened beverage. So comfort food is not so comfortable for your cardiovascular system. And that's the point I want to make here. Again, there is a lot of emphasis on keto and low carbohydrate, high fat, high protein diets. And I get patients with these questions all the time in my clinic. But I just put this slide to show you the evidence directly from AHA ACC guidelines. Low carbohydrate, high fat, high protein diet has been associated with increased cardiac and non-cardiac mortality rate because of that animal fat and saturated fat that it comprises, right? So it's been associated with almost 31% higher risk of all-cause death and cardiac mortality. And in this ERIC cohort, it actually showed that 18% risk in mortality rate with low carbohydrate diet if you use the animal-derived protein and fat sources, but with the plant sources of vegetables, nuts, peanuts, peanut butter, whole grain bread, it was associated with lower mortality. Now, this ERIC cohort also showed us very interesting thing. You see this graph here, and that's the energy from the carbohydrate we derive. So they actually showed that, if you go on, more than 50% carbohydrate intake on your daily, routine food, then that again was associated with, higher mortality. So the optimum amount of carbohydrate intake that one can have, it's between 50 to 55%, particularly because refined carbohydrate has become the issue of our times. Similarly, a slide real quick on the sweetened beverages. So one serving of sweetened beverages leads to 20% increase in frequency of diabetes. And, if you just increase your sugar intake by 10% on the daily calories, you are increasing your risk of mortality, for lifetime. Similarly, the whole grains have, many good effects. The predominant one that I want to show here is more than threefold improvement in diastolic blood pressure when you use whole grains rather than the refined grains. And some of the examples are right here, in this slide. So not all plant food is the same, right? So refined, carbohydrate and unhealthy plant food have been another issue for us. And actually, it shows that if you are a very unhealthy plant food eater, then your mortality is worse than people who eat animals. So consuming a diet that is, with juices, sweetened beverages, refined grains, potatoes, fries, sweets, it actually leads to higher coronary events than the increase that is seen with the consumption of animal products. So I feel like the message, is very simple, and the bad stuff is red meat, trans fats, refined carbohydrate, and sweetened beverages. And so for me, a message from a cardiologist or from a primary care provider is, very simple. Consume green leafy vegetables, legumes, nuts, PUFA and, MUFA, whole grains and fruits, and stay away from the processed food. And that's a very simple message about diet. And with that, we'll take more questions.
Well, thank you, Dr. Parwani. We are having some really great questions come through. So why don't we just get to the questions? The first question is intermittent fasting helpful or harmful?
Yeah, so there was a recent study that came out of University of San Francisco, which showed that there was no benefit of intermittent fasting when they compared it with standard. Now, there is some criticism of those studies. In my opinion, any of these dietary patterns work because they put restriction on your calories. So that's the most important thing. You restrict your calories in any form. You restrict it. You're going to, not allow yourself to eat junk food, and that's what works. So I think, again, the message is very simple. Don't go for these fancy diet. Just stick to the basic rules, which I showed you.
What I love what you said was that you said let's make it simple, and it really is simple. When we watch over the decades, I think probably around the 90s, it was a no fat.
Yeah.
fats were bad, and then we went into carbohydrates were bad. And it's really, these things aren't necessarily bad. It's what types of carbohydrates, what types of fats you're eating. And what I Dr. Parwani, what I love what you did too is you went back to the evidence. A lot of times when it comes to our diet, we look at celebrities who look wonderful and they did this diet or whatever, we see on TV or on Facebook or on the internet, and we take that as fact. What we have to do is really go back to the research and the evidence, is what you did clearly today, which I thought was wonderful.
Yeah, no, we need to let the science speak. I think that's the message of this COVID era, right? We need to let the science speak, and we need to stay away from misinformation, whether it comes to diet or it comes to vaccine, COVID vaccination. I think the message is simple: go back to the evidence and stay away from misinformation. Check your sources.
Yes, absolutely. Well, you brought up COVID, so that was the next question that came up, is does COVID create heart disease?
Oh, wow. So that we have actually done a lot of stuff on COVID and heart disease. So definitely check out, Loma Linda website for that. And we have actually started a COVID heart clinic, which I'm the director of, and I'm doing it with some of my amazing colleagues. But yes, COVID can lead to damage to the heart. And, basically what COVID does is what bad diet does. It causes inflammation of the vascular lining, and that lining can happen. It can happen within the heart, it can happen within the blood vessels, or it can happen outside the lining of the heart, right? So a lot of patients we are seeing, they're coming with like newly diagnosed high blood pressure or palpitations, conduction system issues. And then the ones that have been very sick with COVID in ICU, they unfortunately, some of them have heart failure. They have developed heart failure. COVID also increases the chances of clots in the heart vessel as well as vessels in the body. So we have seen also heart attack that are precipitated by COVID. So COVID is definitely associated with heart disease. If you have pre-existing condition, your risk is higher. Hence, my message to all of you, please take the vaccine.
And I mean, just a matter of anatomy, the heart and lungs are connected.
Yes.
Like the rest of us are. Our mind, we said stress, so all of these things work together.
Yes.
So we have another question, which is another great question. What type of exercise helps the most?
Yeah, so that's a great question. So, when I talk to my patients, I think that we need to realize that, exercise can happen with different gradation. So in simple words, again, putting the advice simple, moving helps than sitting. Couch potato is worse than, anything else in this world. So if you move, that would help you. If you're looking for cardiovascular benefit from exercise, then you need to increase your activity to 4 to 5 mets, and what that's like metabolic equivalents that we talk in cardiology, right? So activity the examples of these activity I can give is like brisk walking. So if you're walking, just doing a leisure walking, or you say 1 hour I'm walking but nothing is happening, well, speed it up, because the benefits, cardiovascular benefits, are seen with a little bit more activity. Or you can, playing with the kids or playing with the dogs, that involves a bit of running, and that kind of, brisk walking and, picking up your exercise would help you. Of course, doing weights, etc. helps, but yeah, any amount of exercise helps in a long run.
And the heart is a muscle, so you push it like you would if you want to get a great bicep.
Yes. Yes, that's a great example.
Another...
I also want to just say real quick, Dr. Moses, is that, a lot of people believe in this concept that, oh, you can burn it all out. I can eat anything because I'm going to exercise, and, I want to burn all of that by doing heavy exercise. I will tell you this, that there is no evidence that LDL goes down even with the heavy duty exercise. Mm-hmm. So you need to combine exercise with your diet. Mm-hmm. So this whole concept, if anyone is giving you that concept, that's wrong. You need to combine diet. You need to be eating right for your exercise to be effective. And absolute LDL does not go down just with exercise. So it will lower your triglycerides and it will increase your HDL. But when it comes to LDL, you need to combine the approaches. So Just wanted to say that since you brought
No,
up exercise.
no, that's a great point. Unfortunately, exercise doesn't make all the bad things evaporate, unfortunately.
Yes.
Yeah. So, we've talked about atherosclerosis and how we all kind of have it, and it starts progressing early, which can be very scary. And if, let's say, some of our viewers are diagnosed with heart disease, or they know they have atherosclerosis, is this something that can be reversed, or is it something that we just treat after it happens?
No, that's a great question, Dr. Moses. And this I get this question all the time from my patients. So I think that we know that atherosclerosis, when they looked at people, the soldiers after the World War II, people were, the people did not have enough food to eat. So people that died after World War II, they didn't find much evidence of atherosclerosis. Coming back to the point that atherosclerosis is so tightly related to the diet. But there are some studies, like a study by Dr. Ornish, who I greatly respect, and Dr. Esselstyn from Cleveland Clinic. They have shown some anecdotal evidence, and weekly design trials that the atherosclerosis can be reversed with plant-based diet. I highly respect them, but I can point out a lot of weaknesses in those trials. But nonetheless, I do think that good plant-based diet stabilize the process of atherosclerosis. Statin data of statin on reversal of the atherosclerosis, it's a bit controversial again, but the least I can tell you that there is some evidence that the new medicine for triglyceride called Vascepa, it reverses the atherosclerosis. So in short, with diet and atherosclerosis, I think there are some anecdotal examples that it reversed the atherosclerosis, but we have to use that data with grain of salt. I do think that regardless, it stabilizes the process.
Thank you so much, Dr. Parwani. This was absolutely fantastic, and I could absolutely talk to you all day long about this very topic, but we have run out of time. But I want to thank you for being here and donating your very valuable time to us on this National Heart Health Month that we're promoting heart health. And just to kind of summarize, can we just maybe say that exercise is medicine and nutrition is medicine when it comes to heart health and basically everything else?
Yeah, no, thank you. Thank you. I'm honored to be here and, speaking to you, and you put the message, in those golden words. Yeah, exercise matters and food matters. So stay healthy, because that's what matters for heart. Thank you.
Thank you. And if you are a newcomer to Wellness Live, or if you're a regular visitor, I want to invite you to our Wellness Live next month. We are going to be having Dr. Michael Hogue, who is the dean of our School of Pharmacy at Loma Linda, and he is going to be talking about the COVID vaccine. So you do not want to miss that important Wellness Live presentation. It's going to be on March 25 at our new time as noon. So if you would like to join us live, or if you want to just come and see us afterward, it will be on our YouTube page for Loma Linda University Health. So I want to invite you to our next session. Thank you for joining us. And again, thank you to Dr. Purvi Purwani for this excellent presentation. And with that, I'm going to bid you goodbye today and say, be healthy, be happy, and live a wonderful, joyous, well life. Have a great day.